You're listening to Weird Medicine with Dr. Steve on the Riotcast Network, riotcast.com.
I need some suction. Yeah, my carotid.
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heart valve, exacerbating my inevitable woes. I want to take my brain out and blast it with the wave, an ultrasonic, echographic, and a pulsating shave. I want a magic pill for all my ailments, the health equivalent to Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease, so I'm paging Dr. Steve.
Dr. Steve, you'll take account for
It's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio, now a podcast. I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical practitioner who keeps the alternative medicine assholes at bay. Hello, Dr. Scott.
Hey, Dr. Steve.
And she who will do most anything for a glass of expensive wine, it's Lady Diagnosis.
Hey, Dr. Steve.
This is a show for people who have never listened to a medical show on the radio or the internet. If you have a question you're embarrassed to take to your regular medical provider, if you can't find an answer anywhere else, give us a call, 347-766-4323. That's 347-POO-HEAD. If you're listening to us live, the number is 754-227-3647. That's 754-22
penis.
Or 754-bare-nip, which is my favorite. Follow us on Twitter at Weird Medicine, Lady Diagnosis, and Dr. Scott WM. And you can follow our intern, 49 Cent, at WM the Intern. Visit our website at weirdmedicine.com for podcast, medical news, and stuff you can buy, or go to our merchandise store at cafepress.com/weirdmedicine. Most importantly, we are not your medical providers. Take everything here with a grain of salt. Don't act on anything you hear on this show without talking it over with your doctor, nurse practitioner, physician assistant, pharmacist, chiropractor, acupuncturist, yoga master, physical therapist, or whatever. All right, very good.
Brewmaster.
Brewmaster, that's correct. Mm-hmm. I can't drink during this show today because I've got to go back to work after this.
Oh.
Ugh.
Yeah, we lost our weekend person, and everybody else on my team's like, oh, I have kids at home and I can't work weekends. It's like, well, those two things really don't exactly follow. Mm. And I have kids at home, but I'm going to work it because if I don't do it, it's not going to get done. So the good news is I'm going to take, if I work 2 days on the weekend, I'll take a day off during the week.
You know, they make people that you can actually pay, and they will watch your children for you.
Yeah, that's crazy, isn't it?
Yeah.
Well, so you can keep your job.
I know. Crazy.
Don't get me, but I don't want to get off on that because, anyway, maybe certain people might listen to this show, but it's okay. I need some extra time off, and I don't mind working weekends. I did 7 days a week for 7 years when I was starting this program. So, it's just kind of going back to that. And I didn't hate it then.
You don't have to work all night, do you?
No, God, no.
Okay, good.
No. And Dr. Scott and I are going to play I decided our band name is Background Noise, spelled Noiz.
Oh, how cute that is.
Because I really don't want people to listen to us. I just want to be background noise. Mm-hmm. So have you decided, are we going to amplify ourselves tonight, or are we just going to sit out there and play? Or is he going to have a PA already?
Yeah, no, we're just going straight acoustic.
We're going
Ooh,
straight
like
acoustic.
it.
Okay. Now, when
I'll be in the front row.
This is playing on Tuesday. 2 days from now is going to be Vic Henley at Allendale. So go to etncomedy.com. That's like East Tennessee, ETN, Echo Tango November comedy.com. And all the information is there. It's free. This is big for the area that we're in. We really don't get comedians of this caliber here. And what I'm hoping is that we can continue to grow the gravitas of the comedians that we get in. And this place seats 1,200 effing people. And last time we had Tim Dillon. He did great. He got double the number of people that have ever come to one of their events. Mm-hmm. But it looked like nobody was there. I felt bad for Tim because he looks out there and they're so spread out. Yeah. There was, I don't know. They usually get 100 people. They had 250 for him. So it was a big deal. But it just, you looked out there. He even took a picture of it. And he said, oh, this is going to go great. But it ended up being a great, great event. It really was. But I need more people to show up for this. So it's free. It's free. So
Thursday night. There's nothing else going on.
right, and even if you're coming from out of town, so take a long weekend. Come here for this, and then go up to Asheville or go to Nashville, or make a long weekend out of it. And if you come see Dr. Scott or I, or Lady Diagnosis, and come say hello, I'll try to get some tokens, and you guys can go get a free beer. I'll talk to the beer guy, see how we can work that out. Okay.
Can I get a free beer
Yeah,
if
of
I talk
course.
to you? Okay.
Or they can go right down the street to the riverfront.
That's
our
right.
new beer run location.
We can do that
Love
after.
it.
Well, we won't be open after this is done, though. will
Well,
it?
you have a key, don't you?
We do. We have the key.
Hello.
Think we can do extended hours and tell everybody to head over there after the event?
Yeah.
Yeah?
Yeah.
Okay.
Absolutely.
So we'll do a little thing at the beer run that evening. We'll have to pay Charlie a little
bartend.
bit.
There you go.
Did you get your draw permit?
You gotta have a pour. You
You
gotta
got to
have a pour license.
permit,
Yeah.
a pour license.
A license to pour beer.
And we don't mean PORE
Or
or
POOR. I do
or
have my
POOR.
POOR.
the the PORE license. That's Lady Pimple Popper.
Yeah.
And then
She's got a great job.
POOR.
yeah, that's
That's the sucky pour license.
that's
I
right.
have that one.
That's the one we get from SiriusXM.
Exactly.
But anyway, it's good to be on there. I'm not complaining. I was on Howard again.
Oh yeah.
Howard who?
Yeah, that was Howard who exactly for the third time. Howard Stern.
Shut up.
Yep,
Really?
Yep. Yep.
Wow, I'm so impressed.
It was fun. Well, Shuley, you remember Shuley?
Right.
Oh, yeah.
You ran him around for the funniest person in Tri-Cities competition.
Mm-hmm.
He, we've stayed in touch, and he was such a nice guy. And he, my kids liked him, and we think he's really funny. And he was so good that night. I mean, he just made that night.
He is.
And for the Howard Stern listeners that hate Shuley, I don't get it. He gets a lot of hate on Reddit and stuff. And I have to defend him. He was fantastic.
He was wonderful.
His
yeah.
stand-up was hilarious. He did 30
His
minutes
crowd
before the
interaction.
thing. He
Right.
he did crowd work. People were dying laughing. And then during the event, he was, it was all ad-libbing. We didn't know what the hell. We had 9 different comedians do stuff. And then he would comment on it. He was playing the Ryan Seacrest part. And then he made jokes out of all this stuff, and it was really, if they were bad, he made them funny, and if they were good, he made them funnier. And then he at the end, people were like, "Can you do more comedy?" So he did another 20 minutes and got a standing ovation that wouldn't stop till he left the stage.
Yeah.
Now, come on. So anyway, but Shuley and I have stayed friendly. And when they have something that's medical, he'll call me. And they called me in Hawaii at 3 a.m. one day. That I couldn't do that. I missed that call. But yeah, it was fun. And then every time now, of course, I called into Jim and Sam. They were talking about black holes and universe stuff and physics. And so I was talking to them about that. And of course, the whole preamble is, was Howard on vacation today? And all this kind of stuff. Catching shit. XM 103 is still our home, and it always will be. But nobody gave 2 shits when I was on Montel Williams' show or when I was on the Bob Rivers show or any of the other shows that I've been on, or Bob and Tom back in the day.
Oh, I love that show.
Nobody gave 2 shits, but all of a sudden I was on Howard Stern one time and I started catching hell from the 103 people. It's just funny. It's just something to give me shit
They're
about.
just jealous,
No,
what my
it's
mom would say.
And they're right. They're just giving me shit. All right.
Right.
Hey, don't forget to check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. And he's really spruced up his website. And the greatest thing on there, GVAC used to love this, the fatigue reprieve. And my wife likes the stress less. But my favorite thing is the Simply Herbal Sinus Rinse. I use it every day. It's the greatest stuff in the world. And even my voice sounds better when I use it on the air.
Gives
So-
you that cigarette voice.
well, it
Yeah.
gets the mucus out of there, so,
Right.
so I'm not have like a gurgly, yuck. I hate that when I hear that in people, and when I have it myself, I hate it even more. Don't forget, please use stuff.drsteve.com, stuff.drsteve.com. There's all kind. It's just a click through page. You can just click straight through and go to Amazon, or you can scroll down and see a lot of the different products that we've talked about on this show, including the amino acids and other things that I use to basically cure my peripheral neuropathy when my neurologist said, "Hey, we ain't got nothing we can do."
Well, there was something else you did before you started the supplements.
Well, what?
Stopped your statin.
Well, yeah, that's true.
Because once you stopped it,
well, I did the two at the same time, and Dr. Scott is absolutely correct. I'll give you that. Wait a minute. Whoops, what?
Give yourself a bill.
That is true.
So
you went from being
I'm trying to sell some
Simply
fucking
Herbals.
snake
Yes.
oil, dude.
Yes, I love it.
You're telling me, well, that wasn't what it was.
well. I'm
No, I'm
supporting
just
you.
kidding. I know. I appreciate it.
No.
So
I'm
I
just
have a
kidding.
question
Yeah.
on the app. I have the Amazon app.
Yes, you
Can
can't
you
use
direct
no.
it? So you just have to go through the website.
You have to go through the website
Okay.
to use our link, unfortunately.
Okay.
But anyway, and don't forget tweakedaudio.com, offer code FLUID, that's fluid, for 33%
Fluid.
off. That is a huge discount. You know, Papa John's will give you free pizza every 20, it used to be frequently, now it's like every 20 pizzas or something. But tweakedaudio.com will give you 33% off every single order you place if you will use the offer code FLUID. And they're a Tennessee-based company, had no idea until a couple of months ago. We got to go out there and see them.
I'd love to.
We need to do a road trip.
We need to go to New York first.
Okay, I'm in on that. I have no PTO time, but if I keep working a bunch of weekends, I'll be able to do that.
Work every
So-
weekend for the
Yep.
rest of the year.
And if you want the archives of the show, and why would you? I don't know why,
Why would you
would,
not?
but go to premium.drsteve.com for $1.99 a month. You can sign up and have access to everything, including premium content. So, all right. First thing, on our SiriusXM show, we had a guy on, and we took the whole hour and talked to Robert D. Rose Jr., who is a guy who is a veteran. He was severely injured during training exercise and has severe chronic non-malignant pain. And the VA has this new thing where they really want to minimize the number of pills that they're writing, and it seems to at times not have any correlation with whether somebody's got legitimate pain or not. They just want to decrease the number of pills that they're writing. And so Robert was had a lawsuit, and we had him on the SiriusXM show. Let's have him over here. We're going to do quite an abbreviated thing because you can go back and listen to the SiriusXM show on demand and listen to his whole thing. But Robert, let me bring you up here. All right, can you hear me, my friend?
Yes, Dr. Steve. Can I say one thing?
Of course, you can say anything you want.
Dr. Steve, I went back and listened to that episode, and other than myself sounding like an idiot, you, sir, were awesome.
Oh, well, thank you. Thank you.
I don't know why everybody's not listening.
Well, there's a couple. I like staying under the radar, to be honest with you. But on this particular topic, I wanted to get that one out there as far and wide as we could, because it's a topic that I know something about, and I'm very interested in seeing a logical resolution to this. Mm-hmm. And let me just give the people a little background on my take on this chronic opioid process, or quote unquote crisis. There is a crisis in overdoses of opioids, but they're not pharmaceuticals anymore. The number of prescriptions that have been written for pharmaceutical grade opioids started declining in 2011 or 2010, and it was a precipitous decline. During that same time, the number of opioid deaths increased geometrically. And if you go to my website at drsteve.com, you can scroll down, and I've got an article about it. Scott, you might search for it and see what the title of the article is. And I can put a link up on Twitter. But there's a graph there that is quite stunning. And the reason for it is because doctors got blamed for this, and now doctors are terrified to write anything. They're cutting their patients off, and the street the number of medications getting on the street has decreased significantly. We've closed down the pill mills that really were doing inappropriate stuff. And it's basically legitimate patients now who are being deprived of their medications because we've kind of taken care of the other problem for the most part. There are still pill mills out there, but they've got bullseyes on them. Now, why are the opioid overdoses increasing and deaths increasing at a geometric rate? Well, because it's fentanyl. It's mostly fentanyl that's driving this.
What's fentanyl?
Fentanyl is an extremely potent opioid. We dose it in microgram amounts, whereas morphine is dosed in milligram amounts.
Gotcha.
And it is you can get like 2 million doses out of a pound of this stuff. So it's really easy to smuggle. It's easy to break up, but it isn't so easy to get a consistent dose that's not going to kill people. And so all of a sudden you get a little packet with white powder, and it doesn't have the microgram amounts printed on it. Right? And
how would you distribute a microgram? That's so small.
Well, they'll cut it with other stuff.
Oh, okay.
Yeah. And you can take a pound of fentanyl and make, like I said, 2 million doses out of it that are a gram each or whatever. I don't. Yeah, but anyway, so hang on just a second, Robert, and so that's where we are right now. And now Robert's dealing with a system that has a policy that they want to decrease the number of prescriptions that are written. So go ahead, Robert. You have the floor.
On those micrograms and stuff that you're talking about, people smuggle the stuff in from China and Mexico and buy a pill press from eBay or Amazon or whatnot, and they will press it into pills that look like legitimate prescribed medications. And so you purchase a Xanax tablet off the street, you don't know if it's actually a Xanax tablet or one that has been pressed in someone's garage.
Wow, that's scary, isn't it?
That's one of the reasons it's so dangerous to purchase these street drugs you're talking about.
It's even dangerous to buy them from pharmacies overseas because you can do that. And we had a guy long time ago on the show, it may have even been before Dr. Scott was involved in the show, that bought Xanax from what he thought was a Canadian pharmacy. But when the stuff showed up, it had the stamp on it from a country called the Seychelles. And that's an island off the coast of Africa. And when they had them analyzed, it was actually an antipsychotic that they had sent them. So it's my pharmacist can make a mistake. You can't even, and that's almost a perfect system. I've only my 62 years, I've had one prescription that was wrong. So if you can't, but it's 99.999% accurate, not 100%. So if you can't even 100% trust the system that we have, why in the hell would you trust somebody selling you a packet off the street unless you were desperate? And that's the other side of this, is when I see them creating new legislation to crack down on doctors who are writing these prescriptions for patients with chronic, pain. Where is the money to do the treatment for people to decrease the demand? Because we're not doing anything about the demand. We're getting the pills off the street, no question about it, but the demand is still there, and so they're just going to other sources. But anyway, so Robert.
Robert is.
Tell us about the status of your lawsuit and all that stuff, or your injunction, or whatever it was that you were.
All right. Well, as we mentioned on the show last time, I did have an injunction hearing in Greenville, Tennessee, that was designed to stop the VA and the CDC guidelines that would deny legitimate pain patients legitimate pain medications. However, prior to the injunction, the judge had written in his order that he was going to allow veterans, civilians, and expert testimony. Prior to the actual hearing, he did go back on what he had written in the order granting the hearing. And then also, as you know, Congressman Phil Rowe from Tennessee, 1st District, is named in the lawsuit. He actually, in 2009, when he was elected, he became a member of the House VA Committee. In December of 2016, he became the chairman for the House VA Committee. But prior to the injunction hearing, in order to be excused, he told the judge that he was not affiliated with the Department of Veterans Affairs in any way. So when we did arrive in court there in Greenville on the 17th, it went pretty much as I expected because of the previous phone call, in that, one, Phil Rowe did not show up because the judge excused him for not being affiliated with the VA. The defendants at Mountain Home VA Medical Center here in Johnson City, they did not show up as well, even though the order excusing Rowe did not excuse them. And there's several other little errors that occurred during this hearing that has now allowed me to file a appeal that will take the case completely out of Tennessee. That way Rowe has no influence, has no power in when we go to the Sixth Circuit Court up in Cincinnati, Ohio.
Oh my goodness!
And so that is what is going on now.
Okay.
I have submitted to the court a notice of appeal to let them know that I will be doing this, and at the present time I am writing the appeal information indicating the harm that's been going on and the stuff that's going on. Like I believe I told you last time, I'd spoken to a 70-year-old Marine that had served in Vietnam. He had been blown up in a personnel carrier. And here recently, he was diagnosed with throat cancer associated with Agent Orange.
Okay.
After 35 rounds of radiation therapy, Mountain Home VA Medical Center prescribed to him for the pain Tylenol and throat lozenges.
Okay.
So,
well, allegedly. I mean, we haven't had a chance to look at his record, but I believe him. But we need to say that.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those like lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
If you had been listening to the stories I've been listening to for the past year and a half,
I know, man.
believe me.
No, I know. I do believe you. We have to be real careful about, anyway, when we're talking about specific medical conditions of specific people. But one thing I want to throw out there, I do think that I hate to use the hysteria word, but the hysteria about prescribing by a lot of primary care guys And I do talk to primary care guys, say, I just don't treat pain anymore. And it's like, well, all right. Well, I've just decided I'm not going to treat diabetes. You know, it's 16 million people complain of pain in the United States. And, you know, somebody's got to, somebody's got to take care of that. So, you know, yeah, go ahead, man.
Can I correct you?
Yeah, please.
According to the National Institute of Health, there are 111 million Americans that suffer from some form of chronic pain. 25 million of those individuals suffer from severe intractable pain, which at the present time have no current cure.
Yeah. That's closer to the 16 million number that I'm talking about. Because,
I'm sorry?
No, I was saying that's closer to the 16 million number that, that I was talking about. It just depends on, I guess, where you get that. That's what I'm talking about. The people with severe chronic pain that, it affects their ability to work or be productive and stuff like that. So,
yes, sir.
But the CDC guidelines don't say don't write opioids. And I'm going to read from the CDC guidelines. It says, it is important that patients receive appropriate pain treatment with careful consideration of the benefits and risks of treatment options, which we would do. That's true for diabetes. That's true for high blood pressure.
Sure.
People need appropriate treatment with careful consideration of the benefits and risks. That doesn't mean do not treat. Matter of fact, we teach people if someone's at high risk, and this is for cancer particularly, but that's a different issue. And they'll say, oh, well, cancer pain is exempt from all of these rules, but the insurance companies still won't pay for a lot of them. They'll only pay for a certain number of pills, even if not taking into account if the patient's been on this for a long time and developed tolerance, or if they have, 28, which I've seen, 28 fractures in their pelvis that can't be treated with the doses that they want them to have, And a couple of the insurers are requiring prior approvals every single time that you write the prescription. So I have a department in my office that does all that. I work at a cancer center, so we have people to do that. But if you're in primary care and you have to do a prior approval every single month for both the prescriptions that you're writing for a person that you're just going to quit doing it. You're going to throw up your hands and stop doing it.
Yeah.
That strategy has been very successful. Yeah. Go ahead, Robert.
Not only that, doctors, but as you may know from following the news, pharmaceutical providers, I'm not going to name names, so I don't want to get in trouble, but there are certain pharmacies that you can go to, and because the pharmacy tech or the pharmacist does not like the way you are dressed, the color of your skin, the car you drive, they can deny the legitimately written prescription for you with nothing more than, I don't like the way you look. And that is giving power to people who have no medical knowledge of your condition or your history.
Yeah.
And believe you me, if that was the what the guidelines said, on some days, the way I feel, I'm not able to shave because my hands are so messed up. I wouldn't give it to me myself.
Yeah.
Even though I know I'm not going to abuse it, I'm not going to divert it. I'm going to take it the way it is because that's the only way I survive. And one thing that you was just saying about doctors. This injunction hearing that I did request of the federal court, it began with a letter from Mountain Home VA to me. It was the first time that they put it in writing why they are not prescribing opioid medication.
Yeah.
Yeah. May I read that to you, sir?
Yeah, and then we'll have to move on, but absolutely. Yeah, give us the short version of it, Robert, if you can. We have a phone bag full. Go ahead, buddy.
All right, I apologize.
No. Don't apologize. I'm just letting you know.
All right, on April 20th of 2018, this is a response I received from Mountain Home when I asked if my new primary care provider would be able to treat the compression fractures in my spine. Doctor,
I'm gonna have to bleep that. Okay, get the time 26:27. We can't use any real names, Robert. Sorry, we can use yours and mine, but not anybody else's without their permission. It's okay. I'll bleep
I don't hide.
I know. You can say it, and I'll just bleep it. Okay.
Here we go. Dr. Blank.
Thank you.
Will not, or how about Dr. B, will not be able to prescribe either. He lives under the same rules as all our providers here at the VA. Not our choice to stop narcotic therapy at this point. Due to the VA-wide opioid safety initiative, as previously discussed in detail with the patient.
Okay.
So it's not the doctor's choice.
Right.
They are being threatened with disciplinary action or termination if they continue to prescribe. So, to me, it goes back to Hitler's useless people policy in Nazi Germany. Everybody knows the 6 million Jews that were murdered, but there's very little talk of the 5 million others that were murdered under his reign of terror. The majority of that 5 million was the elderly and the disabled, because according to Hitler, they were useless.
Yeah. Well, I know.
They provided nothing to society.
I know, being in your
we've
position at this point, I think I can understand how you would feel that the system does not value you because they're not listening to you, and that I understand. And that's something I think the pendulum's going to swing back the other way. I think it's already started, but we'll be following your case with some very great interest, and I welcome you to call in when it gets closer to the Cincinnati thing and just let us know what's going on. And keep us apprised of what's going on, old buddy, because I feel for you.
It's all in God's hands.
Well, and in people who care enough to stick their neck out a little bit and try to, get some things done. So we'll be following that very closely, and I really do appreciate you keeping us in the loop. And just take care and keep in touch, okay?
Always, Dr. Steve.
All right, my friend.
Always.
All right.
And take care, and God bless.
And thank you for your service to your country. We appreciate that more than you know.
Yes, sir.
All right.
Bye.
Yeah, that's tough. That's really tough. So we'll see what happens over the next thing. So he's going to go to Cincinnati and get it out of our jurisdiction, so at least we can talk about it without any fear of having a problem. Yeah. All right. Well, anyway, I do think that a lot of providers are throwing the baby out with the bathwater.
Yes, they
are. That's my stand on that. And what the VA is, I have no idea. I don't work in the VA. I don't know anything about it. What I hear about it is what he tells me. So, I wouldn't mind at all having a VA doctor in here, particularly one that will, we can mask their voice and they can tell if there is such a person.
Well, I can tell you for an absolute fact, they sent letters out to all the veterans who use the VA in Mountain Home, and about 2 years ago that they were discontinuing all narcotics.
Oh, okay.
For all patients, unless they had,
cancer or hospice or something like
end
that.
Stage cancers.
Yeah, okay.
And the problem is, the one thing that he said that is the most difficult is the definition of legitimate pain.
Of course. We don't have a blood test.
We do not. And as well as I do, Dr. Steve, we've got people coming in with a hangnail that say, oh, my God, it's a 10 out of 10 pain. and we've got somebody else that's hit themselves in the shin with an axe and say, yeah, if you can put a Band-Aid on
Right,
it.
right.
And that's why it's so hard.
The knuckleheads out there are the ones that have ruined it for all the legit patients. There's no question about that.
So
and, ultimately, we are looking for non-addictive pain medications that will work. And one thing that we talked about on the SiriusXM show was having a multifaceted approach to chronic pain.
Right.
That isn't just the Romans lining up in a line and trying to, poke, swords at the guys on the other straight line in front of them. Instead, you try to flank your pain. Just that's how the Romans got defeated. Their enemies learned how to flank them and violate the quote-unquote rules of war. If you use opioids when they're appropriate and not be afraid of it. I'm looking at the CDC guideline. It does not anywhere say don't treat people with opioids. It just says select your patients appropriately and treat them appropriately using the lowest dose that's effective, which is true of any medication.
Yep.
You don't give somebody twice the blood pressure medicine that they need. You give them just enough to get their blood pressure down into the range that you want it and keep it there. And
you encourage them to do things that would help control their blood pressure. And that's what I think a lot of the patients that we have in pain medicine, the ones we have the most trouble with are the ones that want to be pain-free.
That's right.
And pain-free is virtually impossible if you're alive.
That paradigm has been thrown out, and everybody. But that's part of counseling people when you first see them.
Yep.
Is that what we're looking for is an improvement in function and
quality of life.
Improvement in quality of life. And if the only way we can eradicate all pain is either to treat the underlying condition or sedate the person to the point where they're in a coma.
And may I say one more thing about the VA and Mountain Home in their defense? Because,
I know people over there, both patients and doctors, and I know
they are, but they are doing some extraordinary stuff over there. They've got brand new classes that any of the veterans who have chronic pain can go to. Then involve everything from breathing techniques to yoga, massage therapies, et cetera. I mean, all of these stuff in-house that they do, and it's some really great stuff. And we're seeing some great response from that.
The problem is that if you've got someone that's withdrawing from opioids, the last thing they want to hear is you telling them about a yoga class.
I know.
So this has to be started from the beginning if you're going to do all these things. And anyway, our multifaceted approach would include opioids, would include what Dr. Scott does, despite what that asshole on iTunes said. Dr. Scott has a bunch of modalities that are very helpful for chronic pain that are proven in the medical literature. So go F yourself if you start calling him a quack again, because I'm say the same shit I said last time. And other non-opioid modalities, including physical therapy, adjuvant medications like Neurontin or tricyclic antidepressants and things like that. All these things have adverse effects too. But treating all of those, you can maybe decrease the amount of medication all the way around if you use multiple modalities. So anyway. So, here we are talking about chronic pain again, but it's a big deal. It's in the news every day. And, it's I know people at the VA who are trying to do the absolute best that they can possibly do, both patients and doctors. And but I absolutely understand people like Robert having the frustration that they have too. So we have to be able to address that and come up with a solution that's acceptable. But anyway, all right. So let's move on. We've got everybody else has been on hold for 32 minutes. Area code 267. 267, you are on Weird Medicine. Sorry for the wait.
No problem. Hey, Dr. Steve.
Hey.
I got a quick question for you.
Sure.
So I just had my daughter was just born about 9 days ago.
Okay, congratulations.
And, thank you. When they were doing the... Thanks.
Yeah, go ahead.
So, what's that?
I didn't mean for the studio audience to throw you off like that.
Oh, no problem. So, when they were doing the initial exam, they said that they felt like a click in her right hip, And then they've been checking it periodically, like every time they do her assessments and everything.
Yep.
And it's like every other time, maybe every third time they feel it.
Okay.
And then the doctor ordered an ultrasound on her right hip.
Yes.
And that was done when she was 7 days old.
Okay.
The guy, it was actually done by a doctor. They said that it couldn't be done by a technician. It had to be a doctor that did it because she was so young. He didn't go into details, but he said it was definitely abnormal.
Okay.
But he wouldn't explain what he meant.
Oh.
And
Okay.
since then, like the next day, she had a regular checkup, and the pediatrician said that it was inconclusive because she's so young.
Yes.
And they want it repeated when she's going to be a month to 2 months old.
Okay.
And my wife and I are just wondering, like, is this anything that, I don't know, obviously you haven't seen the ultrasound.
Yeah.
Is this anything that we should be concerned with or anything? They basically said, at worst, she might need, like, a hip brace or something until she's about 1 year old anyway.
Sure.
So it doesn't sound like it's that big of a problem. But, we're just wondering.
Yeah. Well, they should have sat you down and had a nice long discussion with you rather than going, well, it's abnormal.
Yep.
We'll see you in a month. I hate that.
Thanks for coming.
Yeah.
Don't worry.
Good luck to you, old buddy. No, it's we always screen in babies for this thing called hip dysplasia. And the way you do it is you get the baby on their back and you put your finger, your middle finger, right on the greater trochanter of the hip, that sort of bone that you can feel sticking out.
The hip bone.
And then you put your thumbs on the inside of their knees, and then you use that as sort of a fulcrum or a pivot point, and then you pivot outward with your thumbs, spreading their legs, and then you feel to see if that hip clicks when you do that, because you've got your finger right on it. You can feel it. It goes doop, 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 like that, okay? So that is a screening test for a thing called hip dysplasia, and it's the medical term for a hip socket that doesn't fully cover the ball portion of the upper thigh bone. So what can happen is the kids sometimes can grow out of that clicky and they're fine. Other times it does manifest as problems later on in life. They can get one leg could be a little longer than the other, or they may develop a limp, stuff like that. In teenagers and young adults, I had a friend who had untreated hip dysplasia, and she had a real hard time getting around because she had pain and stuff. So,
oh, wow.
Yeah, but hers was untreated. So I'm just let me Google real quick, see how they're treating this these days. Yeah, they use this thing called a Pavlik harness, and it is, just as you said, a brace. And what it does is it repositions the baby's hip so that it will learn to grow properly, so that socket and the hip and the ball joint will merge together properly. And it says here, infants are usually treated with a soft brace, such as a Pavlik harness, that holds the ball portion of the joint firmly in its socket for several months. This helps the socket mold to the shape of the ball. This brace doesn't work as well for babies older than 6 months, but that's not a problem for you, so because they caught this so early. So, and then, if that works, then
They're golden.
Yeah, they're golden. They can play football, they can run, they can do whatever they want to do. So it's good that they picked up on this so early. But they should have explained this shit to you. It's crazy you have to call a radio talk show to get this answer when the information was right there in front of them. All they had to, they could have given you a fucking pamphlet.
Yeah. I probably could have Googled it too, but I don't want to.
Not your job, bro.
You look up the wrong thing and you fucking freak out.
Yeah, it's not your job. But Google infant hip dysplasia, and that you'll have all the information you need. And yeah, they just need to keep an eye on the baby for the next month or two, and then if this doesn't seem like it's going away, then they'll put you in that Pavlik brace, and it'll be inconvenient for a little while, and but 18 years from now you'll forget about it completely.
Yep.
All right.
Okay.
The other thing, let me ask you this.
Well, thank you.
Is this your first baby?
No, this is number 2.
Oh, okay. Well, I was going to say you could go to drsteve.com and in the upper right-hand corner, click on my wife's one-page baby manual that she wrote, and it is it's a wonderful way to get that kid sleeping all night, which is the thing that's everyone's goal in the early days of having a baby. So, but anyway.
Yeah, we've actually been using that because I had a conversation with you when our first one was born. So yeah.
Oh, okay, cool, cool.
It's a great guide.
And the other thing that we like, and Tacey and I give everyone who's having a baby, are the sleep sacks from babyinabag.com. And they're wearable.
Okay.
They're wearable blankets. We kept our kids in them. They've got a bunch of different sizes, from the 3-month to a year size to toddler size. And as long as our kids were in the crib, they had a sleep sack on until they were 2, and they never once crawled out of their crib, not one time, because they can't. It's awesome.
Oh, okay, great.
Yeah, but the sleep sack's great because after 3 months, when that kid now is no longer just a fetus that's been delivered 3 months too early, because that's the truth of human delivery, is we're born about 1 semester too soon because our heads are so big. And if we didn't do that, women would have to have a vagina that's way different than the one that they have now. And so I'm sort of glad that we do it this way. But but they so we swaddled those kids for the first 3 months, but after about 3 months they can kick the blanket off, and that's when you stick them in a sleep sack. So
okay, great.
All right. Hey, good luck. Good luck with the baby. Keep us in the loop, and let us know how the hip dysplasia thing's going. I love hearing follow up on these things. I hope everything goes okay.
Okay, thanks a lot. Have a great day.
All right, buddy.
See you, man.
Okay, we'll see you. We've got one more we'll take now, and then we'll get out of here. Area code 732. You're on Weird Medicine.
Good afternoon, gentlemen. How are you?
Good, man. Good. I like that radio voice.
Well, I don't know about that, but
No.
I have to take a second because I have to laugh. The caller, the veteran before with the VA issues.
Yep.
When he said Dr. Blank, my head went to Anthony Cumia, Chris Hansen voice, and all I kept thinking about was put my blank in your blank. He did all those voices. Oh, never laughed so hard in my life when he would do that. Oh, it was classic.
Oh yeah.
Anyway, I'm sorry.
No, it's okay. I was sitting in a meeting, and the guy next to me, his name was Chris Hansen, and so I gave him all the to catch a predator jokes. He had no clue what I was talking about, and I was just sitting there looking at me like I was an idiot. The other time that happened to me, by the way, was we had a resident, and his name was Muhammad Ali. And he was standing in this group of residents, and I saw him, and I saw his name tag. It was Muhammad Ali. And I started going, the greatest resident of all times, of all times. And he just looked at me with this goofy smile, and he went, well, thank you very much, sir. He had no clue what the hell I was talking about.
He had to have heard something about that.
No, well, he didn't know
twice.
that reference.
Oh,
I mean,
okay.
that was 40 years ago.
Oh, okay.
But anyway, so
yeah, I heard
it made me
that
feel
name.
old and stupid. I'm just, why? He must have thought I was the biggest idiot.
No, he had to know with a name like that.
I don't think he
had
did.
to-
I don't think he'd been in the country that long. And although Muhammad Ali is one of the most famous people in the world, there was no recognition in his eyes
That's so
whatsoever.
funny.
But anyway, all right. Well, anyway, what you got, man?
All right, so kidney stones.
Yes.
And I'm not concerned about the treatment thereof because
Okay.
it's pretty much a pretty standard form. Either you pee them out or they go get them in some form.
Right.
I get the understanding of that. But I'm 42. I don't know how far I can go with my history, but I'm not the healthiest of people.
Okay.
In the last 16 months, I have made myself healthier in weight loss and exercise and all this other stuff.
Excellent.
But I've never had kidney stones before.
Okay.
And my issue is and I struggle with this, so just bear with me. But I became one of those. I'm not very good at it, so don't judge. But I became one of those CrossFitter people.
Yeah. That's fine.
I'm just wondering if there's something behind it, in the sense, not that I'm doing something wrong,
Right.
but is there something related to the output versus the input in terms of hydration
Yes.
and electrolytes and everything like that? That because I'm not good at it, but I do take it hard during the workouts, and that's why I've actually lost 40 to 50 pounds in the last 16 months, is because that was like my breakthrough moment. But, the treatment is one thing. I get that, and that's pretty standard stuff for the most part.
Do you know what kind of stones you
background.
have? I'm sure they analyzed them.
Yes.
What kind of stones do you have?
Yeah, I had the CT scan, I had the ultrasound, and I just had the X-ray about a week or two ago.
Well, that's not what I'm asking. What I'm asking is, did they take a stone out, crush it up, and do a chemical analysis on it?
No, I actually have two. One is about 3 millimeters. The other one is in a tough spot. It's like 14 millimeters, and they both still sit inside my body.
So you have not passed a stone yet that they could analyze.
In fact, 2 days ago, when I tried to get on the last time, when I kind of hung up on you, so I apologize for that.
Yeah, no, that's fine.
I was actually in my urology office, and the decision was to put me on high dose Flomax to try to pass the one.
Yeah.
Rather than go beat it up with a shockwave lithotripsy stuff.
Okay.
So I have not passed a stone. I am pain free. It never bothers me. I'm not on any pain medicine. There's no issues with it.
Got it.
I know I have them.
Okay. So that will be very important someday when they get their hands on one of your stones to say, what kind is it? Because some of them precipitate. You remember in chemistry, you did these experiments where you'd have this stuff in solution. You'd have two clear solutions, and you'd pour one into the other, and then it would precipitate out. Or you'd make rock salt or rock candy, and that's
rock salt. Yeah, Mr. Wizard. Rock
yeah,
salt.
Yeah,
Good.
and basically kidney stones form the same way. It's a chemical reaction where things that are in solution precipitate out, and then they aggregate together, and then they'll make a stone. And you can have calcium stones, you can have struvite stones, uric acid stones, and these other things called cysteine stones. Sometimes you can have, a combination of calcium and, say, uric acid, things like that. So knowing what it is will help you to avoid it in the future. For example, uric acid stones, we can give people potassium citrate, and they will never have another stone. People with calcium stones or oxalate stones can avoid certain things in their diet. But for now, what's interesting you is, what are your risk factors that we can put our finger on right now? One of those is dehydration. So not drinking enough water increases your risk of kidney stones because the urine is more concentrated. If it's more concentrated and there are solutes precipitating out of solution, they're going to precipitate out when the urine is more concentrated. So that's one thing. But the thing that I'm wondering, in your case, since you've lost all this weight, is your diet. So eating diets that are high in protein may increase the risk of some types of kidney stones. Particularly true if you have a high sodium diet, if you use a lot of salt in your food. And so that's pretty interesting. You wouldn't think that sodium would do it because it's not sodium that's precipitating out, but it causes calcium to precipitate out. People who are obese, and other medical conditions that you probably don't have, like renal tubular acidosis and stuff like that, can increase kidney stone production. But I'm going to guess in your case, it's your diet and the dehydration during your workouts.
Yeah.
So you just got to hydrate better during your workouts and see if you can prevent this. And then once they get their hands on one, call back and let us know what kind of stone it is.
Sure.
And then we can they'll give you a diet, but we can kind of walk people through how you, determine the proper way to prevent a kidney stone from reforming. And it's not all stones are the same.
It sucks, though.
Yeah, it sucks.
Yeah,
It sucks really bad. And just,
I was going to say, it just kind of sucked that I'm finally turning the corner.
Yeah, now you got this.
I dare use the word healthy. I don't want to do that. But now I got this. It's not a setback, but I got this complication.
Sure.
I got to go get fixed. And, at one point, I do have to get the one out. The lithotrips are going to beat me up with it, and I'm going to be down for a week or so. But,
sure.
it just feels like it's a kick in the butt. You drop the weight. I didn't say it, but I have type 2 diabetes. My A1C is down like 5.8.
There you go. Congratulations.
Blood pressure is down below. Blood pressure's barely
awesome.
on medicine at this point. All this other good stuff, and then I get the stupid kidney stones.
Yeah. Well, you know what? If I told you could decrease your risk of heart attack and stroke by cutting your risk in half, but the downside would be you'd have to have 2 kidney stones that we'd have to do something about. You probably would have taken that choice.
Probably would have.
Yeah,
sure.
and you did that. That's exactly what you did by doing what you did with your diabetes and your blood pressure. So, and it may even be more than that. If you ought to go, it'd be fun for you to do, is go to just Google Framingham cardiac risk calculator and put your numbers in before and put them in now and look at the difference. And then, let me know what you get, because I bet it was like 10% before and it's down to 4 now. So it's really a 60% decrease,
And it was Framingham, like F-R-A-M, like Framingham.
Like Framingham, Mass.
Okay, gotcha. Yep.
All right, old buddy.
Okay.
Hey,
I
congratulations on the weight
Thank
loss. Sorry about the kidney stones, and let us know how it goes. All right, buddy.
Take care.
Better than I've been in a while. So.
Oh, good.
We'll
good,
keep
good.
it up.
I just hung up on him. Sorry. All right. Thanks always go to Dr. Scott, Lady Diagnosis, and Tacey's here. You going to sit in for the next show? The Tacey will be here next show. Can't forget Rob Sprance, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teft, Eric Nagel, Roland Campos, Sam Roberts, Pat Duffy, Dennis Falcone, Ron Bennington, and Fez Watley. And let's throw old Paul Ovcharsky in there, too, and Dandy Don Wicklund, whose early support of this show never gone unappreciated. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM Channel 103, Saturdays at 8 p.m. Eastern, Sunday at 5 p.m. Eastern, on demand, and other times at Don Wicklund's pleasure. Many thanks go to our listeners whose voicemails and topic ideas make this job very easy. And go to our website at drsteve.com for schedules and podcasts and other crap. Until next time, check your stupid nuts for lumps. Quit smoking, get off your asses, and get some exercise. We'll see you in 1 week for the next edition of Weird Medicine. That's perfect timing. I just got
perfect.
All right.
Has become comfortably numb.